So if I come on to the talk itself, so what is the CSR? What is Dorset's Clinical Services Review? Well, what we're looking at is a comprehensive programme to assess all health and social care across patients and public across the whole of Dorset. So this is a very big piece of work that we're looking to undertake. And we're looking to do that to start with over the next 6 months to do what's called the design phase of the Clinical Services Review. So why are we doing that? Well, first of all, if we look at the national picture, so NHS England produced a survey, or took a survey, and this is some of the information that came out of that survey. I won't go through each of those particular points in question, but you'll see there's a growing trend on there that across the country, and bear in mind this is a national context now. This isn't about Dorset, this is the national context. And what we're looking at here is that there's increasing demand across the country. We've got people who are living longer. Unfortunately, when you live longer, things tend to go wrong with you, and so we need more health and more care. So that's putting greater pressure on services at a time where the money going into services, although it's protected, isn't sort of keeping up with medical inflation. So this looks, again, nationally. This isn't Dorset specific, this is nationally. And so what this is looking at, what's going to happen over the next 6 to 7 years if things carry on as they are. Now, that's not an awful long time, 6 to 7 years. And you can see by the time we get to 2021, there's a forecast nationally of a funding deficit of £30 billion if things carry on as they are. Okay? It's a lot of money. So that's the national context. And more from the national context of the call for action. And you can see down the left-hand side in blue, we have the increasing demand, so the ageing society, the rise of long-term conditions, and increasing expectations against the right-hand side, which is the supply, where there's the increasing costs, there's the limited productivity and constrained public resources. So what does this mean for Dorset? So we're looking at launching the Clinical Service Review, or have launched the Clinical Services Review in Dorset, because services are changing, demands are changing. What we're looking to do is to change our service so that we can provide a safe, high quality and sustainable service for the indefinite future. So what's special about Dorset? We do have some specific problems within Dorset which aren't necessarily the same thing that you'll see around the rest of the country. In particular, you can see number 1 on there, population changes. Now, I'm sure you'll all agree Dorset's a nice place to live, and there are increasing numbers of people who agree with that point of view and want to come here to live. One of the things about that is we have a much higher percentage of older people living in Dorset, and the prediction at the moment, we have 750,000 people living in Dorset, and over the next 5 to 6 years it's predicted that there'll be an extra 50,000 people, so that will top 800,000 people living in Dorset alone. And the thing is that they won't be spread across the age ranges. The majority of those will either be over 65 years old or under 20 years old. So in other words, generally those who aren't in the workforce. So the middle, quality of care. The NHS hasn't changed structurally an awful lot since it was set up. And so Dorset, similar to a call to action, sent out its own survey through NHS England called the Big Ask. And that sent a survey to and got replies from over 6,000 people around Dorset looking at the needs of patients and public across Dorset as to the sort of health services. And there are some growing common themes or trends that came from those. The sorts of themes that were highlighted were that people would like to have care closer to home where possible, better access to care, and 7-day services. So actually having services across 7 days of the week where appropriate. And then finally, financial resources. this is what's currently happening in Dorset. So at the moment, last year we were on point A on that graph. Now, it depends how easy it is for you to see down there, but the black line, as you can see where that's running, is running quite shallowly, and that's the amount of money coming into the NHS in Dorset. The red line is the amount of money that we're spending on healthcare in Dorset. So you can see in 2013-14, we're in surplus. This financial year, all three hospitals, so Dorchester, Poole and Bournemouth, are forecast to be in deficit, so overdrawn this year. And the situation is only going to get worse in the future, to a point where it's at an optimistic prediction by 2020-21, just in Dorset alone, we'll have a deficit of £167 million per year, which cumulatively would be nearly £600 million by that time. So the question is, we need to do things differently. Doing nothing is not an option. If we carry on as we are, we'll be bankrupt. I'm not going to get political. We have a general election next year, but really it doesn't matter what colour of government we have. We're not going to have those extra resources to go along that red line. They're going to go along that black line. So we need to look at doing things differently. And so what we're looking at tonight and discussing with you is how we go about doing those things differently, and how we go about setting about looking at addressing those three different issues on the previous slide. So the population changes, the quality of care, and the financial resources. So I've answered the what, I've answered the why. So what I'm going to do now is to hand over to Phil to discuss the how. Before I do, Phil's going to have a talk to you. After that, we've got half an hour where we're going to be walking around the boards again. There'll be myself, there'll be Phil. I've got Paul French, who's a GP at the back. If you wave yourself, Paul. And I've got Chris McCall, who's also there, waving at the back. So we'll be scattered amongst the boards. So if anybody's got any questions about the boards that they'd like answered, if we can answer them, of course, not necessarily be able to answer them, we'll try to do so. If we can't take any answer, we don't know how to answer, we'll take your details and we'll endeavour to find out those answers for you at a later date and get that back to you. Okay. At this point, then, I'll hand over to Phil.
Good evening, everybody. I'm Phil Richardson. I'm the Director responsible for the Clinical Services Review. What I'm going to do is pick up from what Simon said and talk about how are we going to do the review. And then I'll be available over on the stand over here if anybody wants to ask me anything specifically about the process or where we are with certain topics. So I want to start with looking at the aims and principles of the review. And essentially what we're doing is looking, as Simon says, the 750,000. So there are approximately 766,000 people in Dorset that could potentially use healthcare. And we're looking to see what would be the right services for that population given the financial situation that we have at the moment. So the key thing is that it's not just hospital, it's hospital and community, so it's in hospital and out of hospital. So it affects it covers the GPs, it covers community nursing, it covers the ambulance, it covers community hospitals and the three main hospitals. But we're also working with Yeovil and Salisbury because they're our near neighbours. And we're also talking to the people who live on the Hampshire-Dorset border because they also use services in Bournemouth Hospital. So we're looking at a very wide population and we're looking at all the health providers within it. The three organisations that are currently excluded are retail pharmacies, opticians and dentists, local dentists. But dentistry in a hospital would be included. Anything to do with eyes in a hospital would be included, and anything to do with pharmacy in a hospital would be included. The really important thing about this review is that it's clinically led. So all of our sessions have clinicians in them, and it's clinicians in the broadest sense. So it's GPs, and you'll meet 3 GPs here tonight, but it also includes hospital physicians, hospital specialists, nursing specialists, community nursing specialists, community hospital specialists. So it's everybody involved in the full clinical process. Simon also touched on social care. So we're also working closely with the local authorities in Dorchester for Dorset County Council, Poole and Bournemouth, because we see there's a really close connection between being in the community, going into hospital and coming back into the community, and that is in the main run by the social care organisation. So also working with them. The clinical part needs to be evidence-based. So this is not about just somebody having an opinion. It's not about just somebody sitting in an office somewhere in the NHS saying, we know the right thing for Dorset. What we're actually doing is we're looking at all the clinical evidence base that exists for the patients of Dorset or the people of Dorset. And there's a sample, as Simon said, there's a sample of that in this room this evening. We're gathering data from the Big Ask. We've got 141 separate patient-centric reports that we've gathered. We're also taking feedback from tonight's event. We're taking feedback from other GP events that are happening in parallel to this. We're taking feedback from other events happening in hospitals, other events happening in communities, other events happening with NHS staff. So we're taking all of that input, and we're using that to help us figure out what the options are for Dorset. In terms of the scope of the review, I wanted to share with you the clinical scope. So this evening we've come here to present to you the same information that we've presented to the clinicians. So we've taken a subset of the data, because in the time we have available, there's not time for you to look at all the data that exists and form an opinion, but at least there's a subset of the data for you to get a view, and as Simon said, we'll answer the questions as best we can on that data. But what we wanted to do is share with you the 4 clinical areas that we're working on. So we've taken 4 broad clinical areas. One is maternity and paediatrics, and that's everything to do with pre-conception right the way through the birth process into paediatrics, which is obviously with children. We've also looked at urgent and emergency care and how we're dealing with that. We're looking at planned and long-term care, and we're looking at care for people with long-term conditions and frail and elderly. And as Simon said, the data we've currently got shows that the population is getting older, and as I've talked to you this evening, I've aged you all by at least 10 minutes. No, not everybody. Some people only 6 minutes, right? So we're all getting older. And the other thing, with age comes complexity in terms of conditions. So we have more complicated conditions, and we're getting older, and that only gets worse as the population ages. So looking after people in the long term is really important. So this chart here, what I've tried to do is to show the sequence of things that we're doing as part of the how are we doing this. So at the moment, we are on the purple side, on the left-hand side, which is to review the existing data, engage with everybody that's affected by this, so it's the clinical people and the public. We're then going to take all of that data and work through with the clinical teams to come up with, well, what are the right services? If you are the population in 10 years' time, what your needs are, so you've got needs now and your needs in the future. If we take you as a population and say, what are you going to need in the future? We can then say, what services do we need to be able to solve those needs? Then we have to look at how what the landscape of Dorset looks like, and say, well, where would be the best place to deliver those services? And then we have to say, with the money we've got, what is the right shape for Dorset? So that purple blob on the left-hand side, which takes us from now, so we did the launch on the 22nd of October in the Bournemouth International Centre, and now we are obviously in December. We've started, all the data gathering's already started, and we're going to work through until the end of spring, whereby we will have, based on the population we've got, and what we think their needs are going to be, based on what we know already. We're going to look at what services that we need to put in place, and we're going to look at how we're going to structure those services in the landscape of Dorset, and we're going to come up with some options. So there's not going to be a decision taken, there are going to be some options, and then we'll share those options with you in a formal public consultation. And then we'll take your feedback, and we'll incorporate that feedback into the work we've done. And then that will come back to the NHS, who will say, based on what the population needs are, what services they're going to need, how we can best configure it for the money we've got and the money we expect to get. This looks like the options that we have. We'll have consulted with you. This looks like what's favoured by the population of Dorset. And then we'll take a decision, and then we'll implement that decision in Dorset. So that takes us through that full chart. So the left-hand side is where we are now in the purple. We'll then go through the summer where there'll be a formal public consultation. We'll then come to a decision in the autumn, and then we'll start that implementation effectively from the end of next year and then forward. Now, some of this isn't going to happen quickly, so it's not an overnight quick fix, because I'm sure you appreciate the complexity. We've got about 670 GPs. We've got 3 big hospitals and 11 community hospitals. We have all the district nurses. We have all the ambulance people. We have all of the occupational therapists and psychologists and everybody who's working in the community. All of that will need to be adjusted to fit in with what the new plan that we effectively come up with together. And so that will take some time to roll out. And I've just put an indicative time of somewhere between 2015 and 17. Some of it will come much sooner, some of it will take a bit longer. But that's essentially what the plan is. In terms of how can you get engaged and how can you be involved and how can you have your say and how can you have your input, we're in that process right now. So we've started with 2 really clear things from the beginning of the programme. One is it needs to be clinically led. We need to get from the clinicians what's the right thing to do for the population. So it's really important. And we need to involve you, as citizens of Dorset, in helping us shape what's the right thing to do for you in Dorset. So the process starts with, we did the launch at the International Centre in Bournemouth, but we appreciate not everybody can get to Bournemouth, and I think even if you live in Bournemouth, it's hard to get to Bournemouth. And we need to go right out past Lyme Regis to the west, and we've got to go north to Gillingham, and we come across here into the sort of the northeast corner. So we need to get out to as many people as we can. And I'll just do a plug now. I would encourage you to bring all your friends to the next one. Will you do that? Yeah. Thank you. So we need to get as many people involved in the discussion, because it is the discussion which is going to be about your health. So we're filming tonight, which is obviously can go out for those people who can access films, but actually I think talking to each other about it is probably the best way of doing this, and asking questions. And so I would encourage you to take part. And the fact you're here tonight is absolutely brilliant. So that's a great, for me that's really great. In terms of continuing engagement, we've got, as we move through that journey from design through to options for the consultation, we'll run a number of sessions, and Francis, which I'll invite Francis up in a second to take you through what that looks like in terms of dates and locations. But also we're going to update the web. You look like a group that would all be on Twitter. Is that right? Would that be fair? No, definitely not. Thank you very much. Yeah. Make sure you get my best side for your tweet when you send it out. But you read the newspapers, do you? Right? And you listen to the radio and you watch the news and you talk to each other. So there are we're going to be doing loads of those things, and obviously we could appreciate your help. So if you are on Twitter, then retweeting stuff we send out. What about Facebook? Yeah, a couple of people on Facebook. So we've got a page on Facebook, so you could look at that, make your comments, raise your questions, and at the desk at the back you can sign up for emails, and lots of you might have heard about that already. Can I just get a show of hands who got an email for tonight? Brilliant. So email is pretty pervasive. What about hearing on the radio? Did you hear about it on the radio, anybody? No? Yeah, one or two? Okay, but email's the winner then? Right, good, okay. So what we want to do is engage in a conversation with you. We don't want to just come and tell you things. So tonight we want your opinions, we want your views, we want your thoughts and comments. So we don't want this just to be, we've already decided here's the answer. Because actually, as I stand here, I have no idea what the answer is. All I know is we've got a huge amount of data and we've got some emerging themes, but the clinical team haven't thought through what that might mean for services. So you're right at the very start. The green part on there is formal consultation, so that's where citizens of Dorset, you'll be engaged in, should you want to be, in looking at those options, asking questions of those options and giving your feedback and opinion and comments. And then finally, there's a participation piece which takes us across the implementation. Is the deal has to be, the NHS can do so much, but if you're not looking after yourselves, it's going to break at some point. So we're really going to need your help with all the smoking and the drinking and the fast food and the lack of exercise and all those things which all the people in the room do, right? No, all the people who didn't come tonight do, don't they? So it's all of those things we're going to have to do a deal which says, actually, if we could start to look after ourselves and we start to work with what we can do as an NHS, actually between us we could make this work. So there's a massive participation piece which we're in it together. But I think people feel like that about the NHS anyway, don't you? At the moment, there is no preconception about what the future looks like, but we are working with the NHS providers in Dorset and their clinicians to help us figure this out. We're working with the GPs, as you've seen here tonight. So there is no answer because we're actually basing this on what is the clinically available data, what are the patient needs in Dorset, what's the view from the people in Dorset, what does that mean, including some of the things, I imagine some of you got questions about transport and how that will work. Some of those things are all feeding into this process. So in terms of our future vision, so we've got three key parts of this. There's clearly patients, which we've talked about. There's the staff in Dorset, and as Simon said, there's a squeeze on that middle piece in terms of working population. So we're going to have an elderly population, we're going to have a very young population, and in the middle there is a squeeze. So there's currently a shortage of certain clinical staff in Dorset. And as this population changes, that's not going to improve. So we need to think about our staff. Are they appropriately trained? Are they in the right place? And are they working on the right things? So that's really important. And then the services, we need to think about things like accessibility. We need to think about streamlining things. We need to think about balancing care between community and hospitals. Should all the care that's currently be done in hospitals be done in the hospital, or could it be done in the community? So there's questions like that we need to think about. So what's the emerging case for change? So we've started on something we've called the case for change. So going forward, we need to have a really strong argument to say, this is the reason for doing it. So Simon's laid out what the drivers are for this. So it's about the financial position, about the changing, aging population, and about the quality that we need to give quality services. But that alone isn't enough to convince everybody that this is the right thing to do. So the clinical data we're pulling together is to show what that looks like in terms of things like access to GPs, in terms of how you get treated if you've got a stroke, what happens to you in the different hospitals, what's the performance of that, what's the performance in terms of discharge out into the community, where are the beds getting blocked, all of those pieces of analysis, all that data is being done. So we end up with a case for change which starts to look at things like this. So we look at clinical performance, and it's different in different parts of Dorset. So there are areas that we know can be improved, and we could do something about that. We've got really strong medical experience, and we have got some really good examples of best practice, best in the UK and arguably best in the world. But we've got them in pockets. We don't have that universally across Dorset. So can we get some of that out, and can we get everybody working to that level? We've got different views around the different parts of Dorset. So we're very clear that Dorset isn't one place. Dorset's lots of little places. And when everybody thinks about this, they think about it from their own perspective, and it's that perspective that we want. So we want to get input on, is it different here to Lyme Regis? Is it different here to Weymouth? Yes, I guess you would argue that. Is it different to Poole? Is Poole different to Bournemouth? What actually did that population need? And we've got some of the population data on one of the charts, which you can have a look at, which shows that there are areas which are different levels of wealth. And different levels of wealth leads to different types of diets and different types of behaviours and different ways of living their lives, which changes what the medical needs are. So we need to look at all of that. So the key areas that we're focusing on are the population and its overall health needs. What happens in primary care? So primary care is where the GPs are. What happens with that bunch of GPs? What happens in terms of the acute hospital? So that's Dorchester, Poole and Bournemouth. In terms of their clinical performance. What happens in terms of the care provision? And what's their operating performance like? And then finally, we're looking at other out of care, which includes the ambulance and how patients get moved around between hospitals is a big topic. And then how we look at community-based things like mental health and the link to social care. What I'd like to do is to hand over to Francis now. And then when we get back later, what we'll do is, as I say, we'll put a panel up here, and then we can answer any questions.
Good evening, everybody. My name's Frances Avis, and I'm one of the engagement and communication leads that's supporting this work. When you arrived this evening, I know that most of you, I think, had a chance to have an initial look at some of the emerging data that's supporting the case for change. Now that you've heard about the call to action, about the clinical services review itself, and also about the emerging case for change, we wanted to give you another opportunity to peruse that data and to have a look at that in some detail. We're very aware that a lot of the information is quite detailed and quite technical, but we wanted to give you the chance to see what the clinicians are seeing. We don't expect you to comment in depth about every single slide, but we just wanted to give you a flavour and an opportunity to comment. What we'd like you to do is, bearing in mind the questions that you see up here, and we'll leave them up, is to have a look at the slides, and then considering those questions, capture your thoughts, your views, your questions, your comments on post-it notes and attach them around those slides. And then what we can do is we can collect all of that information together and make sure that your views and comments feed in to the case for change. Very importantly, it's important to stress that this is draft data at the moment. It's still being added to, and it's still being validated. So your input is very, very important. Also, as Phil said, at each of the touch points on the stands, there will be various clinicians and members of staff there to answer your questions. So we hope that you find this opportunity an interesting one to get a real feel of the work that we've started to do. After about half an hour, we'd like to bring you back to your chairs so that, as Phil said, we can give you the opportunity for you to tell us your observations of what you've seen and to ask us any questions that you have. And we'll have a panel of people here to answer those questions. And then after that, Simon will tell you about next steps and the forthcoming meetings that are happening in January, so that you can put them in your diaries. And as Phil says, tell your friends and perhaps double or triple the attendance for tonight. That would be great. A good aim. And also, obviously, Facebook and tweet everybody as well.